The Agenda in the Summer with Nam Kiwanuka is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Looking around public places these days, it can be hard to tell. Is the pandemic over? I'm Nam Kiwanuka. Tonight, we'll put that question to the Scientific Director of Ontario's COVID-19 Science Advisory Table on the Agenda in the Summer. This summer, Ontario dealt with a surge in COVID-19 cases. But in many ways, life got back to something closer to normal. Ontario's COVID-19 Science Advisory Table has been offering guidance throughout this pandemic, though there are reports today that it's about to be folded. Dr. Fahad Razak is Scientific Director of the Science Advisory Table and also an internist and epidemiologist at St. Michael's Hospital, Unity Health, and a professor at the University of Toronto's Termity Faculty of Medicine. And he joins us now on the advisory group and what the best science predicts for the next few months. Hello, it's nice to have you here.
Hi, good to be with you.
A report broke that's been confirmed that the scientific advisory panel is about to be disbanded. This story in the Toronto Star says, the Science Table's peerless pandemic dashboard would be eliminated, its access to data gone, its project stranded. In its place, PHO would establish a hand-picked 15-person advisory group with no formal scientific director, limited independence from PHO or the Chief Medical Officer of Health, no ability to unilaterally choose topics of study, for instance, and far less clinical expertise. And that's from Bruce Arthur from the Toronto Star on August 25th. The Science Table confirmed this Friday that it was going to be disbanded in a tweet, and you also confirmed that news yourself. How do you feel about this decision?
I'm personally sad about it. I think that we've been able to offer hopefully some useful advice on a really complex and really devastating pandemic the last 2.5 years. In my role as the scientific director, and Peter Uni before me, we're really representing the views and work of hundreds of scientists across the province and actually internationally and nationally as well. I think that has value, especially in a very complex area. That said, we were convened with government support, and essentially we're an advisory committee. And when the government decides that they no longer need an advisory committee, that's the end of the process. And so I respect that that is how this works. We have an elected government. That's what their decisions and their job is. So I respect that.
We should also mention that you're all volunteering your time, and a lot of Ontarians have been turning to the advisory table because we've stopped doing PCR testing, and your wastewater data has kept us to date on what's happening in the province. How will this impact what Ontarians know about COVID within their communities?
It's an important question. I think it remains to be known. So I felt confident that we were able to provide certain kinds of information. There are many groups out there. There's other scientists. The government has a lot of resources. Public Health Ontario has wonderful resources. My hope is that that information that I think has been critical will continue. We, as the Science Table, won't have a role in producing it anymore, but it doesn't mean that it has to stop. It can be produced by other groups with very high quality.
Well, what Bruce wrote is that there is going to be a new table. Will you remain on it?
We haven't seen any official details about this table, so I'm not sure about what it will look like or members. To my knowledge, nothing has been posted. So I think it remains to be seen. I honestly wish whatever table exists and PHO and the government the best of luck, because their success means people in the province are healthier. And so whatever can be done to support their work, I think, is valuable.
Does it matter if it's independent from the province?
I think independence matters a lot, and there's not a hard and fast rule on what independence means. I can tell you what most of the scientists on the table and what would more broadly in the scientific community be considered independence. That includes being able to choose what is important to focus on, especially in a complex pandemic. Sometimes the choice of those topics can be difficult. Coming to an assessment of what the science shows and then being able to communicate that openly to the public, to government, to the scientific community. That's what we consider to be really at the heart of independence. I hope that those ideas are preserved. But like I said, I, like you, have not seen what this new group will look like. And, I hope that it's there.
We are in the 7th wave, and I'm hoping that you can give us an idea of where we are and what the fall is going to look like moving forward. We experienced the 7th wave this past summer. Where are we with this latest outbreak of BA5?
It's been a very difficult wave for reasons that are not what we expected earlier in the pandemic. So our feeling on the pandemic was you have these difficult waves, people flood into hospital, they're sick, some are in the ICU, and that's really where the big acute strains are. And we just had proof right in front of us now that you can have a wave that infects a lot of people where you don't get all of those ICU admissions. Our ICU admissions really actually didn't rise very much in this province, but yet you can see the enormous strain. So you're seeing emergency rooms closing. You're seeing staffing problems all across the health system. You're seeing staffing problems wider in society, not just the health system. I think we have to recognize that the virus can challenge us, our health system, our societies, our families, our communities, even if you don't have a lot of people become critically ill. And I think the real worry heading into the fall is that kind of pattern of damage will recur. And we're in the 7th wave. We're coming down from the 7th wave now, not very quickly. Levels of circulating virus, the amount of tests that are positive, depending on what you're looking at, they could be 5 to 10 times higher than they were at the end of summer 2021. So we're actually heading into this fall season with many hospitals having real trouble operating at a time that is traditionally a recovery period for hospitals. Just like we all take summer vacations, hospitals normally are slow in the summer. Hospitals are under enormous strain heading into a fall and winter, which is traditionally the high pressure season for hospitals, not just because of COVID, but because of influenza and other conditions. So I'm very, very worried about our health system heading into the fall and winter.
I was just going to ask you a follow-up to that because the last few years we've had masking in place. We're going to school, people going back into the classes, universities. How do you see, what are you expecting this year, not just with numbers, but the healthcare system itself? As you mentioned, this is usually a time when people in the health profession are maybe taking holidays, but that hasn't been the case.
Yeah, I'm very worried. I'm saying this not only as a scientist, but as a physician who works in the front lines in a hospital, caring for those really sick COVID admissions. I've done that over every wave so far, but also influenza, heart attacks, diabetes, all of the conditions that require hospital-based care. I have never in my career seen hospitals have this level of stress in August. We traditionally have very difficult times in December, January during influenza surges, but I have not seen this happen before. And to me, it's very worrying heading into that fall, winter season. We have taken a system even before the pandemic that had extremely constrained resources. So if you look at Ontario and Canada, the number of hospital beds we have relative to our population or the number of doctors and acute care nurses we have is among the lowest in wealthy countries. This is before the pandemic. Then the pandemic hit, and now we've had 7 waves of enormous stress on that already constrained system. And people are burnt out, and people are retiring, they're moving to other work, and the human resources required to run our health system, I do not see an easy fix for.
I remember in the early days of the pandemic where we had daily press conferences telling us how many cases were in the province. Now we don't know that, and because we stopped testing, PCR testing, it's only for a certain group of people. How many cases are we seeing, and how many deaths is this province seeing?
So right now the number of deaths we're seeing is low relative to other times in the pandemic. So as I said, the number of people who went into ICU during this wave was relatively low compared to, for example, earlier waves. But deaths can occur in other ways. So, for example, from January to June of this year, in 2022, we had more people die over the age of 60 from COVID at any time since vaccines have become available. So during the Omicron wave, we had more people over the age of 60 die.
That's alarming.
Yeah, it is alarming. We had an enormous surge of deaths occur within the lowest income neighborhoods in the province during this wave as well. So it's important to realize that even though you don't see necessarily a lot of people in ICU, people can really be harmed by this, and they can be harmed in many other ways. And I think that's important to recognize. And the fabric that holds this system together is clearly fraying in multiple areas. And that's what I also worry about. So there's people who are still getting very sick, and there's the ability for the system to manage volume and demand, which is really frayed.
You recently co-wrote an opinion piece in the Global Mail on the current healthcare crisis. In it, you say, with healthcare systems dangerously close to the brink, it is utter folly to ignore the reality that this winter may well see new COVID-19 waves, along with a resurgence of seasonal viruses such as influenza. We must double down on simple public health measures that can reduce the burden of respiratory viruses and keep our healthcare system working right now. When you talk about those simple measures, what are those?
Yeah, I want to be clear that the reason we wrote that, so that was written with the current and future president of the Canadian Medical Association.
Catherine Smart, and then the incoming
Yeah,
Alaika Lafontaine.
Plus David Naylor, who chaired Canada's SARS-1 report. So who was the person who chaired the first report when we originally had SARS-1 that came through many years ago. So this was a considered perspective from people who are seeing what's happening across the country and have also seen us through prior pandemics. The worry is that the problems in the health system, structural capacity, number of beds, our long-term care capacity, the number of nurses we have, the number of doctors, these are not easily fixable problems. This is not because of any one government. These problems have occurred over decades, and they've been getting worse. If you remember, before the pandemic started, one of the major issues in Ontario was hallway medicine. Well, what is hallway medicine? Hallway medicine is capacity strain. It's not having enough capacity to care for people who are coming in sick. So these problems are long-standing. Now, COVID has clearly made them worse. And the idea that we were trying to put forth here is that the long-term problems are going to take time to solve. They're not solvable in a few months. They're going to take years to really address. What can we do right now to keep the system functioning over this likely very difficult fall and winter season? And that's where controlling the pandemic to the full extent possible becomes important. And 2.5 years in, we know how to do that. So it involves really 3 major things. The first is keep your vaccines up to date to reduce your chance of getting severe disease. And those vaccines will at least protect you against transmission over a period of weeks to months. The second is reduce your individual exposure risk by things like using high quality masks. And the third is improving air quality. So we clearly know what to do here, but it's hard. It is hard.
Why is it hard?
So people are exhausted. People are exhausted. It's 2.5 years. We in the scientific community, government, policymakers, we all expected that this would not extend as long as it's extended. People are exhausted. Many of these steps, I think there are challenges with, for example, masking. I personally use a mask, and taking my mask off for this interview is one of the first times I've taken a mask off in an indoor setting. I wear a mask in all indoor settings, but it is different for me to wear a mask than requiring everyone to wear a mask mandate. My personal feeling on it is that mask mandates have a lot of value because what is the alternative? To me, what is the alternative is the question. We are clearly seeing problems right now. What is the alternative? So that's my personal perspective, but you can see that it's been a very divisive issue, and that's why it's hard to implement. You have people who have really, really strong positions on both sides, and they're really dug in right now.
You did wear a mask until you sat down, you put it in your pocket.
Right.
But when you were talking about those simple measures, the Science Advisory Table recently released some recommendations on the return to the classroom, and the report that you released read in part, mask wearing is likely the easiest temporary measure to implement if required to support ongoing school operations. But yet the science table says it was unable to reach consensus on whether to recommend masking in schools. Is it understandable that some people in this province, some Ontarians, might feel as if they're being abandoned by public health and by the government?
If people are disappointed and having issues with trusting the system, I understand why that is. This has been evidence that has changed rapidly over the last 2.5 years. So it's very difficult for us to have consistency in messaging when what we know today is different than what we said a month ago. And there's the rapidity of change. It's happened not just for masking, it's happened for vaccines, it's happened for a lot of things. If you remember with the AstraZeneca vaccine, the medical community, my wife got the AstraZeneca vaccine, our premier got it, our prime minister got it, but yet within a month we were saying that there's an alternate option. How do you maintain people's trust when you have this kind of rapidity of change? I don't have a solution for that. This is an incredibly difficult problem, specifically about masks in schools. So I just want to be clear that the evidence about masks being protective against viral disease are 100% clear that masks are protective. The better quality mask, the more protective. So at least a surgical mask, if you can wear one comfortably, an N95 mask gives you more protection. Mask mandates in a school setting based on the latest evidence we have. So Public Health Ontario did a review that was published just this year in March that looked at all studies of mask mandates in schools. They work. They reduce viral spread. That's clear as well. So then the final question is, when do you implement that mask mandate? How much virus does there have to be spreading before you can implement a mask mandate and require it? There's not as much clear scientific evidence. And what you saw in those guidelines was uncertainty and some differences between scientists. And that's a risk threshold issue. So what is my personal risk threshold? I'm a parent of 2 children under the age of 5. I'm a physician who sees really sick patients in hospital. My personal risk threshold is I think that masks have a really important role early before you start to have a lot of viral spread. I'd like to see them required. But different people have different risk thresholds on this question. And that's where you saw some spread between the group.
I think because no one wants to see schools shut down again, right?
Yeah.
But you mentioned the simple measures, and masking was one of them.
Yeah.
We know that vaccine uptake for 5 to 11 has not been that great. Boosters are still not available for 5 to 11 in this province. Do you worry that if things do become worse in the fall, as you've mentioned, that if we were to pivot and ask and need the simple measure of masking, that would be really hard to, because the trust has kind of been broken, you agree, right?
I agree.
Do you worry about that?
I do worry about it. I think that we need to improve our ability to message in a coherent way about what is required, and we need to find ways to get the public to trust us. I don't think we're in a state of distrust, don't get me wrong, but the proof of what has changed is in the first 2 years of the pandemic, when our messaging was go out and get your vaccines, as an example, Canadians and people in Ontario did that to the extent that if you look at the entire OECD, which is a group of, entire G10, which is a group of wealthy industrialized nations like ours, like the United Kingdom, the United States, Germany, Italy, very comparable countries. We had the highest vaccination rate of any of those countries in the first 2 years for the first 2 doses. So clearly our messaging worked, and people in Ontario and Canadians went out there and got those vaccines. If you look at the 3rd dose vaccination rate now, we are not top anymore. We are solidly middle of the pack for these countries. So our ability to message this in a way that the public understands and their trust in taking that up has clearly frayed.
Well, we've been hearing that a new vaccine will be available this fall, the bivalent vaccine. What is it?
So the bivalent vaccine is a vaccine that takes the original vaccine that was developed against the virus that came out of Wuhan 2.5 years ago and adds a second component to that vaccine, which is now targeted towards the Omicron strain that started to become a major issue here in Canada starting January of this year. It should give some additional protection against the current circulating viruses that are out there, which are in that Omicron family. The one that caused this immediate surge was the BA.5 version of Omicron. We don't know what's coming in the future. So we don't know if the next waves that are likely to come, and I say likely because we've seen waves occur every 3 to 6 months so far. So if you're seeing what's already occurred, the expectation is another wave is likely going to arrive sometime in the fall and winter. But we don't know if that will be related to Omicron and have some protection from this bivalent vaccine, or be something that's completely different, like
a new variant?
Like when Omicron arrived, or Delta or Alpha, like a completely different variant. The bivalents, who are they useful for? So I think that if you're eligible for a bivalent vaccine in the fall, you should take it, because it is the best protection we have in place right now. But it doesn't preclude the fact that a different variant may arrive later in the fall or winter that the protection is not as good against. And vaccine development is incredibly difficult. They're playing a catch-up game. They're trying to develop vaccines against what they're seeing now, but they don't know what's coming in 3 to 6 months, and it's very difficult.
A recent report by the COVID-19 Immunity Task Force said the Omicron wave from December to May has infected over half of Canadians. What does that mean in terms of herd immunity?
So it's certainly probably at least 50% of people got infected. Among young people, it could be even higher. And that means that we took a highly vaccinated population. So Ontario and Canada has a highly vaccinated population, and we layered on infection on top of that. That combination is called hybrid immunity, immunity from the vaccine, immunity from the infection. So most people around us now have hybrid immunity. We probably are benefiting from that in an important way as a society. And the proof of that is that when the BA.5 wave came through, although a lot of people got infected in this last couple of months in the BA.5 wave, in the 7th wave, we didn't have a lot of people end up in ICU. And that's probably this wall of immunity that we've now developed against severe infection. So that's great. The worry is that we don't know if that wall of immunity against severe infection will continue into whatever happens in the fall. And it could not be there because either our own immune system starts to lose the degree of protection that it has in place, or it could be that a variant comes through that looks different enough that it allows us to get reinfected. And a great example of that is BA5. Many people who got infected in the last couple of months were also infected earlier this year, but the variant was different enough that our immune system was not able to recognize this as being the same virus, and people got reinfected.
You mentioned hybrid immunity. For all intents and purposes, does this mean now that the pandemic is essentially over?
It does not mean it's over. And in my heart, I would love for it to be over. And I know everyone out there wants to be over. But the level of dysfunction you're seeing in the health system right now in August is proof that it is not over. And remember, this is a recovery period for hospitals. August, as a hospital-based physician, August is when people tend to take vacation. It's when our hours are not as high, when the volumes of patients is not as high. You are seeing severe strain right now today in hospitals. This is not over. It has become increasingly difficult to manage because unlike the early time of the pandemic where it was this surge and there was rallying of the public and the health system, I think a lot of that rallying capacity has started to dissipate because of fatigue. And so we're in a very, very different state. We're sort of in this grinding war now against the pandemic with these additional waves that are being stacked on top.
I want to go back to those simple measures you mentioned. One of them was vaccinations. With this, hopefully getting this new vaccine in the fall. I wonder though, I know you've seen the discourse where people are saying, first I was told 1 vaccine, then 2 vaccines, now 3, now 4.
Yep.
How many vaccines do you want me to take?
Right.
How do you address that? It's one thing to have the vaccines, but what if people just refuse to take the vaccines?
I think some people are not going to get the vaccines. And what I think, again, around from a messaging perspective, have to say is that the recommendations that we make today, the recommendations that we made a year ago, 2 years ago, when we said 2 vaccines and this should give you protection, they're based on our best knowledge in the moment, plus the version of the virus that is circulating at that time. When that changes, so if you take us from a year ago to today, the version of the virus today is dramatically different than what existed a year ago. Our understanding of the immune protection that is derived from vaccines is different. And so these change in recommendations is a change that recognizes that the science of something that just arrived 3 years ago, right? So as a physician, we normally deal with diseases that have been around for hundreds of years, and we have so much evidence to know how to treat them. This is something that arrived 3 years ago. And so our knowledge base of it is also evolving. And the virus has shown just a remarkable and scary ability to mutate. No one expected that a virus would mutate in the direction that it's mutating, where it has become, in some ways, more severe, more transmissible, this ability to escape the immune system. And so a lot of these recommendations are catch-up against something that is fast evolving. And again, who is the adversary in all of this? We as a society, science humans, we're trying to stop something that is nature. This is a virus, and it's going to change regardless of what our perspective is on it. So if we're fatigued, if we don't want to get vaccinated, that virus will continue to change, right?
I keep seeing different people in public health, even politicians, saying that this fall is going to be a rough fall. We want it to end. Everyone is fatigued, as you mentioned. How do you see this pandemic ending?
I don't know. And I think our ability to predict how it will end, we feel a lot less certain now than we would have predicted even a year or 2 ago when we thought that it would be a surge of cases, a few waves that started to have diminishing intensity, and that it would slowly peter out to become something that is a commonly occurring virus, maybe like influenza that occurs in annual cycles, but is something that we deal with in that way, like we deal with influenza, where we don't worry about influenza in the summer. We worry about it in that late fall, early winter season. We have a vaccine that's tailored to that version of influenza that's circulating. We tell people to get their flu shot and life goes on. That's clearly not what's happened here. You're seeing waves occur multiple times per year. You're seeing in BA5 a wave that occurred on top of another wave that hadn't even receded yet. So this is not following that pattern. So what will happen in the future? My hope is that we'll start to see diminishing waves of intensity and these other worrying effects like transmissibility or severity, and that it will start to peter out and we'll fall into a cycle of kind of regular waves that we have regular vaccination against. But whether that occurs next year or 5 years from now, very unclear at this point.
Dr. Razak, thank you so much for your time. And I'm going to say this on behalf of Ontarians. We appreciate the work the Science Advisory Table has been doing. We appreciate your time. Thank you.
Thank you. It's been a real privilege. Thank you.
Did you know that Ontario doesn't have an official animal? Well, thanks to our Ontario hubs, this summer you've got a chance to weigh in on what you think the unofficial official animal of the province should be. Let's get the details from TVO.org Associate Editor Nathaniel Basin. Hello, Nat.
Hey, Dan.
All right, so the public and even other media really got behind last summer's Roadside Attraction Series. This time we're doing the Animal Series. Tell us all about it.
Yeah, so it's my once annual visit to figure out what we're doing in late August. This year, we are deciding Ontario has an official bird, but not an official animal. And so we're drawing from wildlife across the province to figure out what should represent Ontario.
All right, let's get some photos up here. I want to learn about some of the animals that you've actually written about. We'll start off with this pretty guy, which I feel like is probably an underdog, or I should say under turtle. This guy is on the Ontario Endangered Species Act. Tell us about the snapping turtle.
The snapping turtle should absolutely not be an underdog or under turtle. It is so cool. It's basically a dinosaur. It's been around since the dinosaur, Mesozoic era. They're huge. They have an undeserved reputation for being violent. They are not violent, a bit defensive on land, but that's it. And they're just, cool animals that swim around and eat and sleep and relax all day. And it's a pretty aspirational lifestyle, I think.
All right, let's look at our next photo. This is the little brown bat. Now, I will admit I have probably dodged and ducked when I've seen this little bat outdoors. What does this tiny animal contribute to the Ontario ecosystem?
Little brown bat, besides being very cute, is Ontario's only flying mammal, well, along with his other bat species. And for people who don't like mosquitoes or small insects, they eat all of them. They can eat more than their weight in mosquitoes in a night. So that's one big contribution, I'd say.
Big contribution there. All right, finally, the river otter. I feel like anytime you see a river otter, it brings a smile to your face. What makes the river otter a good candidate for Ontario's favorite animal?
I can't believe it took us so long to get here. The river otter should absolutely win. It is 100% Ontario's official animal. It's so sweet and playful. People describe it saying it has a certain joie de vivre because it just plays all day and eats and relaxes. The river otter's great.
All right, so tell us, so it's 8 weeks, 16 animals. How do people take part in this if they want to make their voice or their animal be heard? What do we need to know?
So we're still publishing 2 stories a week on different animals. That'll stop, I think, mid-September, just about. Once that's done, we'll post a bracket and people can vote for their favorite animal, I think mostly on Twitter, and then we'll sort of move on from there.
All right, Nat, great stuff. Really appreciate it.
Thank you for having me.
And that is tonight's Agenda in the Summer. I am Jan Jaganathan. Thanks for watching TVO and for joining us online at tvo.org. Monday, how the pandemic changed the wedding industry.
The Agenda in the Summer with Nam Kiwanuka is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman.